I want to talk about two things we've talked about many times before, but not together. And those two topics are, on the one hand, anti and pseudo-intellectualism, and on the other hand, the COVID-19 pandemic. Now, COVID, of course, we've talked about for a year and a half, every week, and sometimes even more often. We've tracked cases, we've tracked deaths, variants, masks, vaccines, and everything in between. We've also talked about anti-intellectual and pseudo-intellectual movements, and that's a really big topic. And this goes back to the genesis of American intellectualism in the 1800s, or even arguably earlier than that. But it also includes simply an analysis of people who read books by authors like Tucker Carlson and Bill O'Reilly, and they start to think that they're educated and they have a well-rounded and nuanced and detailed view of how the world works, and the belief that one is much more informed than they actually are. But these two issues, anti-intellectualism and COVID, are very much linked. There's a really good study in Nature that was published a few months ago called Anti-Intellectualism and the Mass Public's Response to the COVID-19 Pandemic. And when I was looking through this recently, I realized that many of our previous discussions about anti-intellectualism apply perfectly to what's been going on with this pandemic in the United States. It applies to mask wearing. It applies to anti-vaccine sentiment and to so much more. And the article does a number of different things to assess how people came to believe incorrect things about the pandemic, be it about the virus itself or about public health measures or vaccines or whatever else. And the conclusion is not going to be a surprise. The article finds, quote, "We provide evidence of a consistent connection between anti-intellectualism and COVID-19 risk perceptions, social distancing, mask usage, misperceptions, and information acquisition." Very, very much not unsurprising finding. So there are actually two sides to the people that still won't get vaccinated, that still think masks don't do anything, who think the virus is fake or whatever. Part of it is that they are part of a political movement whose leaders spent basically all of 2020 telling them this isn't very serious, we don't need to do anything, open everything, the economy is what matters most. That's part of it, which is politics, plain and simple. But the side we haven't talked about as much is the anti-intellectualism, a distrust of scientists and doctors, a distrust of authority, feeling that they know more, much like Trump always felt that he knew more than his generals or doctors or whoever, because they read whatever it was on Facebook or because their uncle told them whatever it was. Now, you might say, well, that anti-intellectual view is based on their politics, so it really is still politics. And I would agree with you. But these are still two distinct but related phenomena. And then the last piece of this that I want to discuss is that the anti-intellectualism and the rejection of science is very postmodern, which these right-wingers claim to be against. Now, of course, most of the right-wingers who talk about postmodernism don't have an iota of a clue, not even a scintilla of an idea of what postmodernism is. But to the extent that they sort of understand it, right-wingers claim to hate the postmodern idea that they say exists on the left, that every narrative is equally valid, every opinion must be given the same consideration as every other. And I'll tell you what, I'm also against that. I've talked about my opposition to that idea, that every narrative, every idea must be given equal consideration. But those very same people are furious that their anti-vaccine misperceptions, that their COVID conspiracy delusions aren't being given the same weight, the same consideration, the same seat at the table as what medical doctors and public health officials and science says. It's truly the height of hypocrisy. So we have a political movement that spent all of last year saying you don't really need to worry about this, and that's a big factor. And then, yes, we also have this anti-intellectual, pseudo-intellectual component of people who, because they looked at Facebook, think that they know as much as or more than the public health officials. But then the third layer on top of it is the incredible hypocrisy of being against the culture they believe exists on the left. And it exists in some enclaves of the left, although I don't think it's predominant, that every idea must be given an equal seat at the table. But that's exactly what they want and what they expect with their ideas about vaccines and masks and whatever else. And they become furious when social media platforms or elected officials or whoever say, hey, you know what you're saying just isn't based in science. So we don't need to give it equal consideration. It's hypocrisy plus anti and pseudo-intellectualism plus the politics of the Republican Party around the virus in 2020. Let me know what you think. And is there something missing from that three-layered analysis? I would love to hear from you and add to it in a future segment. We are getting very close, my friends, to the 16th anniversary of the David Pakman Show. August 16th is that day, the 16th anniversary of the David Pakman Show. To celebrate, we will be doing a one-day membership special. If you've been listening for 1, 2, 3, 4, 5, 6, 16 years, and you've occasionally thought, I kind of like this, maybe I'll support it in some way, the perfect day to do it is August 16th. If you want to get an email telling you how to take advantage of our 16th anniversary discount, just get on my mailing list at davidpakman.com.